Thank you, Chairman. On behalf of my party, Apna Dal, I rise to speak in support of the Allied and Healthcare Professionals Bills 2021, which is a historic bill and worth welcoming, and is in fact the second key reform which has been brought by the Government of India, the Ministry of Health and Family Welfare, after the constitution of the National Medical Commission. Sir, if we look at the healthcare scenario today, in India there are a large number of allied and healthcare professionals who are, for years, who have been going unidentified, unregulated, and also underutilized, because we only tend to be focused on strengthening the capabilities of a few limited categories like our doctors, our nurses, or our frontline health workers. Whereas there is a huge potential in these allied healthcare professionals, and we have seen their tremendous significance during the COVID pandemic times also. They very much constitute an important element of our healthcare system, and I heard Dr. Shinde from the Shiv Sena party also mention them like a silent force which has been contributing to the nation's healthcare for over the years. So it's important to understand that the more we skill them and the more we equip them and train them and give them better standardized education and regulate them, we will be able to move towards creating an access towards quality health care. So, globally, most of the countries have a regulatory framework, and they are also providing good education and training to these allied and healthcare professionals who undertake undergraduate programs and obtain degrees. But in India, unfortunately, there is an absence of a robust regulatory framework, and also there is no standardized educational curriculum as well as training for these allied and healthcare professionals. So which is why today, by means of this bill, the government is trying to create a national commission for the allied and healthcare professionals. And there are as many as 56 different categories of these professionals, like physiotherapists, occupational therapists, dietitians, nutritionists, radiology and imaging professionals, psychologists, community health workers, and so many that I'm not taking names of, who will be collectively covered under this national commission which is being constituted. And this National Commission would broadly frame the guidelines and the policies on the basis of the recommendations which will be obtained from the professional councils under its ambit, and it will be the duty of the state councils, which will also be constituted after the enactment of this bill, to ensure the enforcement of the regulations and the broad standards and policies which have been framed by the National Commission, the National Council. And this bill will therefore make a shift from the doctor-led model, which Chairman Sir, you also mentioned about, to a more care-accessible and team-based model, which is very much in line with the vision of universal health coverage as laid down by the National Health Policy rolled out in 2017 and Ayushman Bharat. You must also understand that this bill also creates an opportunity to address the global demand, which is projected to be about 15 million by the year 2030, as stated in the WHO Global Workforce 2030 report. And for this purpose, the purpose of global recognition, the coding of all such allied and healthcare professionals will also be done as per the International Labour Organization standards for classification of occupation, which is a very, very important step. And across the country, there are 8 to 9 lakhs of such professionals who would be covered, along with several other graduating professionals who would be joining the workforce annually, and they will all be registered. A register is going to be maintained, and in case of any offences, penalties would be imposed. So only those who are registered would be allowed to practice. It's very important. However, I have two small concerns which I would like to raise here, sir. My first concern is regarding so looking at the history of the healthcare regulation in India, I have my doubts that there is a scope of manipulation in case of this commission as well. Because how would this bill ensure that the new councils which are being proposed by way of this bill will not go down the same path? So I would like to know from the Honourable Minister that this bill should not just be a good piece of legislation. It should not be just good on paper, but should be good in effect as well. And another thing that I want to point out, sir, that how will this bill ensure that the big players, the powerful healthcare providers, will not eliminate the small players in the garb of ensuring quality services. So these are my two concerns which I would request the Honourable Minister to shed light upon while he's replying to the debate. And with this, I once again congratulate the Honourable Minister for bringing this landmark legislation which will go down in the history of the healthcare revolutions in India. It will transform the healthcare scenario and make a paradigm shift. And thank you, Chairman, so much for indulging me.
Dhanyavad, Anupriya ji. Now, Dr. Manoj Rajoria ji.